I'm Cheryl Wentworth. I'm a family nurse practitioner and I am joining the Aspire medical team. Okay, so personally, I grew up in Utah and in Colorado. I have one son and two dogs, and we love to travel. We run and we love to hike and be at the water, the lake or the ocean, anywhere we can. Professionally, I was a registered nurse for over 10 years. I worked inpatient psych and mental health and substance abuse. I also worked in the hospital. I did women's health, newborn care, and home health. So that was my experience as a nurse. I graduated from Gonzaga University as a family nurse practitioner, and I worked here in the community doing primary care and mental health treatment throughout school. So we did about 30% of our schooling was mental health focused. So there are really two reasons that I focused on mental health. One was personal. Growing up, I had a family member who struggled with addiction. And so as an adolescent, I really saw good mental health care and kind of bad mental health care as well. So that drew me in initially. I developed a lot of empathy for people who were struggling with mental health and their loved ones who were struggling with them. And then professionally, I started in mental health as a nurse. And then I took that with me throughout my nursing career. And when I worked in women's health, I saw we were really lacking in both screening and education for mental health with women. So I really wanted to help fill in that gap and work in mental health as a nurse. So those were my two main drivers. I chose family because I really wanted the full picture of a patient, and then always had that goal to focus on mental health. So I have a lot of experience treating depression, anxiety disorders, bipolar disorder, ADHD. Those are probably what I have dealt with the most. I'm most excited about treating women's health, specifically women's mental health, whether postpartum depression or just treating their mental health alongside of any other conditions they're struggling with. That's definitely where my passion lies. Currently, I've been working in home health as a nurse. I've always known about Aspire as far as the therapy side goes. I watched them start, I watched them grow, and I referred to them personally, and I referred to them a lot through school, and I got great feedback from patients. So they've always been on my radar, and then I saw that they were expanding into the medical side, and I was really excited because therapy was always a part of my treatment plan for mental health. I think it's so important. So I just really wanted to be a part of it as soon as I saw that that was happening, and I just love the team-based approach. I love the idea of working with the therapists alongside of them and treating patients together. So I just can't wait to be part of the team. I think the most exciting thing to me is the team-based approach. I think the evidence shows that therapy along with medication is the best option for mental health treatment, and so I really am happy to work in that model and work alongside a team of therapists, a team of providers that seem really supportive and work together to provide good care.